Today, we're once again going to focus on the current state of the pandemic and how to weigh your individual risk to keep yourself and your family and friends safe. You'll recognize our guest. We're once again joined by Chief Infection Prevention Officer, Dr. Marci Drees. Dr. Drees, thank you so much once again for being with us today.
Hello, Megan. Thank you for having me back.
And if you are watching and have any questions for Dr. Drees during this conversation, please put them in the comments below and we'll be able to get to them throughout this conversation. Also keep an eye out on the comments. We'll have links to CDC resources and ChristianaCare resources that help follow along with this conversation and can also help after we're done here. So Dr. Drees, let's start with an overview of the current state of COVID in Delaware and the surrounding states that we serve.
Well, I think everyone's aware, and we've been enjoying a very nice reprieve from the craziness that was the Omicron surge over the winter. But and our rates of both new cases as well as hospitalized patients basically got as low as they have been almost since the very beginning of the pandemic. However, we are starting to see things start to increase again. It's a little bit confusing because there's two different metrics. There's the CDC community levels, which look at things like hospital capacity, as well as new cases and new hospitalizations, which still remain low for most of the country. But the metrics that we look at to determine healthcare policy are a little bit more stringent. And so they look at things like positivity rate as well as new cases. And Delaware is high by that metric. Almost all of Delaware is, as well as much of the Northeast. So we're starting to see that surge come back up. And that's being driven by, Omicron's subvariant BA2 and sub-variants that are even more contagious than BA2. So the virus is just continuing to mutate, continuing to get more contagious, and it's continuing to evade people's immunity. So even if you had Omicron back over the wintertime, you might be susceptible now to one of these new variants.
So that leads us right into safety and trying to protect ourselves from all of these variants. Mask mandates have been lifted in many areas, but that doesn't mean you individually shouldn't be wearing a mask. And let's talk about the best way to weigh your individual risk. So potentially at the grocery store, if you're going to Acme, if you're going to Target, how can you make that decision if you should wear a mask?
So everything's a risk benefit, right? So there may be situations where wearing a mask is not ideal because you can't communicate well, and you really need someone to be able to see your face, see your mouth, whatever. But things like going to the grocery store, I'm perfectly happy to just have my mask on and don't have to talk to anybody, and there's no reason to put yourself at risk for something like that. Traveling, is it's unfortunate. I think that the federal mask mandate was struck down. I think it's important for everyone to know that that was a court decision, not a public health decision. And I think every public health authority out there still thinks we should be masking on public transit. And we think about flying, yes, the circulation of the air when you're in flight is excellent, but not when you're parked at the gate. Boarding and unboarding, and not necessarily if some person next to you or in the row ahead of you or the row behind you has COVID, you're going to be exposed despite how many times the air is turned over. So I'm actually planning to fly for a wedding this coming week, and we'll all be wearing our masks for sure. And then, and that's only one part of the public transportation. We trains, buses, subways, all of that has been struck down as well. And those don't have nearly the same level of ventilation that airplanes do. So I think those are all really high risk situations, and I would certainly continue to mask. And then the other component is, what is your own personal risk? So are you immune compromised? Are you at severe risk of severe disease? If you were to get COVID, are you fully vaccinated and boosted or not? But even if you're vaccinated and boosted, and even if you're relatively healthy, what impact will COVID have if you to get it on your life, right? If you're traveling, could you get stuck there, right, and not be able to come back? Would you miss a bunch of work because you have to be in person for work? Would your kids miss school? Would you expose someone else in your household who is higher risk themselves? So those are all things you need to keep in mind when you're just making that risk benefit decision.
I'll ask a personal question that I know you just mentioned. You're going to a wedding. I have a friend's wedding coming up soon as well. If it's an outdoor, do you still mask? What is your recommendation and personal preference there?
So I think outdoors, as long as, if you're really super crowded together, like, like I'm thinking like a music festival where you really are jammed together, I probably would still mask because you're still going to be exposed. Most other outdoor venues are relatively safe because you have that outdoor air circulation. The virus just doesn't survive as long, especially if it's sunny. Um, but yeah, I mean, I think, we're going to be careful. We're going to probably bring some home tests with us because we're also going to be visiting some elderly relatives while we're away. So we'll probably test before we go to their house just to make sure we don't put them at risk. Um, but yeah, I mean, it's tough because, people are done with canceling events and they want to get out and they want to travel. They call it revenge travel, I think. But you just have to try to do it as safely as you can.
And so how do you feel about testing? You mentioned you'll be bringing some at-home tests with you. Should we be testing before and after travel? Should we just be testing just because? Where should we be with that?
So, I mean, I think there's nothing wrong with doing regular testing, even if you're asymptomatic. Certainly, if you're symptomatic, you should test. And if your home test is negative, you should seek out a PCR test if you're symptomatic. We know that they're not as sensitive as PCR tests. But otherwise, if you're asymptomatic, certainly before major events, after major events, I think it keeps everybody else safe. And now, luckily, we have much more wide availability of home testing. So it's easy to do. It only takes 50 minutes. There's no reason not to keep, the people that you're going to be visiting safe.
So if we take a test and we're either asymptomatic positive or a little bit of a symptomatic positive or really symptomatic positive, let's run through that. There are more outpatient options for treatment now. There's a test to treat option. So how has that changed? What does that look like now?
So the most important thing is if you are positive with a home test, you should believe it, and you should cancel whatever it was you're planning on doing. So just to not expose anybody else, even if you have no symptoms. If you have symptoms, and especially if you're at higher risk of severe disease, you're older, you have underlying conditions, there are a number of outpatient remedies now, assuming that you're not sick enough to go to the hospital. There are oral medications. The main one is Paxlovid. As well as antibody infusions. And those had been in really tight supply for a while, and now they are much more widely available. So seek out, there are test to treat options where if you go to you can go on there's a test to treat website where you can find specific locations. You can go and be seen by like an urgent care type provider and they can dispense medicine right there. But you can also go to your primary or any doctor can dispense these and you'd go pick them up at your pharmacy. So they are, again, widely available. The key is that you have to take them early. So both medications have to be within 5 days of onset of symptoms. So you want to test right away and seek out those treatments right away. And the monoclonal antibody is, I think, within 10 days.
So we'll do a quick safety overview before we move off of the traveling and testing. Other than wearing a mask when you're on the plane, testing before you go to your big event, let's run through some of those safety reminders to keep people healthy as they go about their events.
Well, I mean, I think, there's many tools in the toolbox now. So it's and no one thing is going to protect you. Vaccines are great. They have saved, probably more than 1 million lives in the US since the beginning of this. And, certainly boosters will help prevent you from getting infections, but probably only for a relatively short time. But your protection against severe disease and death will persist. So we don't expect vaccines to prevent every case. So that's why we need these additional tools like masking, like frequent hand hygiene, like testing, like we just talked about. Having things outdoors whenever you're possible. It's, we're going into warmer weather now, so that will be more feasible for many things. And, not getting yourself in tight situations with people you don't know, or ventilation, any situation where you're surrounded by people and the air circulation isn't good is going to be a risky situation.
So you mentioned the vaccines and the boosters. That's a perfect segue into our first viewer question asking, I am 65, shall I take the second booster? So who is eligible for that second booster?
Right. So, it's been confusing all along because there have been groups where the CDC has said you should get a booster and those that say you may get a booster. So, it's basically your own choice. And for the first boosters, basically at this point, everyone 12 and older is recommended to get at least that first booster. But when it comes to that second booster, it really falls into more of the May if if you're at higher risk. So anyone 50 or older is eligible, as well as younger people, 12 and older, who have underlying immune compromise or other conditions. So it really comes down to, when you're making that choice for yourself, again, it's kind of the same thing. Like, it's your age, it's your underlying conditions. It's what would the effect be on your life if you were to get COVID, and what sort of exposures. If you're a healthcare worker who's 55, you might, even if you're otherwise healthy, you might want to consider getting your second booster because you know that you're going to be exposed more regularly. Or you could be a grocery store worker, whatever the case may be. So right now, it's not a blanket recommendation that everyone should be going out and getting their second booster. I had my parents get theirs. They're in their 70s because we're going to this wedding. We're going to be in a group of people. I want them to be protected. So it's really about, I would say, certainly 65 and older, I would recommend getting it. The likelihood is there will be another round of boosters in the fall, kind of leading up into the winter, respiratory virus season, where everyone's kind of expecting this to rise even higher again. That's all speculative at this point, but I think people are pretty sure that that's probably going to be something that we need to do, make sure that we're as protected as possible going into the winter. But so now, sorry, and the other thing I was going to say is it has to be at least 4 months from your first booster. So depending on, many people were boosted back in the fall when they first became available. So now it's been more than 6 months, and you probably are due for that. But then you'll have, at least 4 months until the fall to enjoy that protection.
And I know in the comment section, there is a link to the CDC that kind of flushes that timeline out for you as well. So if you have more questions about that, please click on that link in the comments. But Dr. Drees, there's that 65 and older group, but there's also the under 5 group who it's not yet approved for them to be vaccinated. Where does that stand right now?
Well, it's a little unclear because both Pfizer and Moderna have been starting their submission process for the under 5 group. So some data has been, they've made, press releases, but, we haven't seen the data in any sort of public forum yet. Initially Pfizer had a 2-dose series and they felt it was not effective enough. So now they're looking at a 3-dose series. I think it's important to know that the delay is not due to safety concerns in any way, shape, or form. It's really about what's the right dose, what's the right number of doses, what's the right interval between doses, and that's what they're still working on for that under 5 group. Meanwhile, the 5 to 11 group have been eligible for vaccinations for some time now, and only about a third of them are vaccinated. So we certainly have, a lot of under vaccination. The most under-vaccinated population nationally is under 30. And again, some of that is, concern about, new vaccine and everything else. But, we have so much data on these vaccines now that I don't think there's any surprises. And I certainly, I think people kind of naturally worry more about a bad thing that might happen if they do something. So if they give their child a vaccine and the child has a side effect of the vaccine, that feels much worse than if they don't give their child a vaccine and they get COVID, right? But in reality, the likelihood of the vaccine side effect is much, much lower than the likelihood of COVID, especially now given, just how frequent it is. And while younger kids are, likely to be asymptomatic or mildly symptomatic, about a third of kids that are hospitalized with COVID, they had no underlying risk factors. So you can't count on the fact that your kid is healthy to think that, oh, well, they don't really need the vaccine. So, we vaccinate for lots of things routinely that kids are unlikely to get, but it's really important, to protect their immunity against all these things. And COVID is much more likely now than any of the other things that we vaccinate kids for routinely.
So I'll ask another kind of personal submitted question then off of that. For those of us who have kids under 2 who can't wear masks and can't get vaccinated, what is the best way to protect those little ones if you are now trying to go out and take them out into the world?
Yeah, you have to do it carefully, right? So you have to make sure that anyone who's eligible to be vaccinated around them is vaccinated. So that might be older siblings, that might be grandparents, that might be daycare providers, nannies, Vaccinate everyone that you can to protect them. And, if avoid taking them into crowded spaces where there's going to be lots of people unmasked. It's tough. I think, before you could fly with your young children because you knew all the adults on the plane were masked, and now you're not going to know that. So I think, it's really difficult right at this moment while that particular piece of the legislation is still kind of, hopefully temporarily lifted. But yeah, I would keep them pretty close to home, to be honest.
And another risk group that we've talked about in the past is the pregnant population. Send that message to those who are watching who potentially are pregnant or have friends who are pregnant about the importance of being safe.
So pregnant women are far more likely to die from COVID than non-pregnant, and especially as they get further along in their pregnancy. So, and their babies are more likely to end up in NICU. There's so many reasons to get vaccinated, to protect yourself, to protect your baby. And, I think there was a lot of hesitation at first just because pregnant women hadn't been enrolled in the clinical trials. That's normal for almost every new medication or new vaccine. It's unfortunate though. But I think, we're now, a year and a half into use of these vaccines, and millions of pregnant women have been vaccinated, and it's been shown to be completely safe. And again, very protective. So if you've been holding out, worried about that, I would not worry.
Thank you. And while I have you, and we're speaking of immunizations, this week happens to be World Immunization Week. So I know you mentioned, kids are vaccinated against all sorts of things, the COVID vaccine. What is your message about the importance of all immunizations as our leader here at ChristianaCare?
Yeah, vaccines save lives. That is the fundamental part of it. And that's what these COVID vaccines are doing. I mentioned before, we're approaching 1 million deaths from COVID in the United States, but it's been estimated that I think 1.1 million deaths have been averted because of vaccination, as well as 10 million hospitalizations. So these vaccines are, people are saying they're a failure because you're getting COVID anyway. They're an absolute success because they're keeping people out of the hospital and they're keeping people alive. And that's exactly what vaccines are designed to do. And all of our vaccines are successful.
Dr. Drees, thank you so much for your time and your attention and your talents as always. And if you're watching and have any other questions about COVID-19, please continue to submit them in the comments. We will be able to respond back to you after this live ends. And also check ChristianaCare.org for any new information. Dr. Drees, thank you so much. Have a great night.
Thank you. Thanks, everyone.